Jennifer, if I can turn to you and maybe continue a bit on some of the themes that we heard from Tori around prevention and preparedness. We've heard a lot over the last day and a half around, the importance of building the local health systems and increasing countries' capacity to respond to infectious threats before they become epidemics. But traditionally, health system strengthening is a hard sell. In the U.S., for example, congressional appropriations tend to favor specific diseases over health system improvements. Can you talk a little bit about how much room you see for health system strengthening, particularly for the U.S. government?
Yes, thanks. So I think I'd like to answer that first sort of a little bit in general and then specifically related to Ebola. So generally speaking, USAID receives congressional appropriations to help developing countries resolve specific pressing health problems. So U.S. bilateral assistance in health tends to focus on essential interventions and priority populations. This includes maternal, neonatal, and child health, and then priority diseases like TB, malaria, and HIV. So at the same time that we receive this assistance to prioritize certain diseases and certain interventions, we also try to carry out this assistance in ways that help countries to adopt health system improvement strategies, to resolve bottlenecks in the system, and to support the development of stronger health systems. So in part, in recent years, our ability at USAID to support these health systems interventions has hinged on gathering evidence about the health impact of health system strengthening interventions, and also the willingness of constituents to invest in interventions that pay systemic gains over a longer time frame. So I think we've been doing this for some time, and I think we now have a pretty robust evidence base that helps us to know a lot about which of these health system strengthening interventions improve health results. So that's kind of all going along in the normal program. And I think the recent Ebola epidemic has made many, many people even more acutely aware of the need to invest in health system strengthening. So I think we see Ebola as a catalyst. During the Ebola pandemic, the global health community got, I think, a huge boost from popular media, from the press, and from the scientific community about the need to support health systems and to make them stronger. So this global attention and the headlines from the news about the failing health systems brought, I think, added prominence to these concepts and to the impetus for system resilience, service integration, and interoperability. So I think all of that was important, as well as highlighting the need to build trust between governments and the communities that they serve. So I think Ebola, particularly for USAID, also broke new ground in that the congressional appropriation, a special congressional appropriation in light of Ebola, both for response and then for rebuilding, appropriated $66 million for health system strengthening in the Ebola-affected countries. So this is an unprecedented type of appropriation, and really a welcome sign, I think, for congressional support for the value and of the importance of this type of work. So they made it clear that we have a responsibility to work with countries to produce more resilient and higher performing health systems. So to do that, of course, as we've been talking over the last couple of days, we face a lot of challenges. To move forward in rebuilding health systems, particularly those affected by Ebola in West Africa, there are a number of challenges that we have to begin to address. One of them is enhancing governance capacity. To mitigate the impact of future crises and the resistance that local communities have in sometimes following their leaders, we need to promote a governance that's responsive and accountable and help to create trust and mutual support between the governments and citizens. We obviously need to improve system resilience. Again, to prepare for future crises, we have to learn ways to ensure that that communities will use quality essential health services and sustain the public health functions that we need to prevent, detect, and respond. I think another lesson is that we need to keep in mind gender imbalances. We haven't focused on that very much at this meeting, but it seems obvious that women were affected disproportionately in the Ebola epidemic, and that we need to make sure that attention is paid to that, and that women themselves can play, given the support they need to play, the catalytic roles in their communities to support this recovery. So I think that there are a lot of opportunities for system improvement. I think USAID really wants to work with all partners to take advantage of that, and also to mobilize new resources. The Ebola Supplemental and the Global Health Security Agenda preparedness effort are examples of that, and a way that we see we can make a contribution to building more holistic and more resilient health systems that can identify these priority health concerns in an integrated way.
Great, thanks, Jennifer. Maybe if we could now turn to a different source of funds, one we haven't discussed much, which is domestic taxes in affected countries. Since pandemic preparedness is a public good, it seems reasonable that general taxation could supply some portion of the funding for it. Can you comment on the role for donors in helping countries actually improve their tax collection systems, and give your thoughts on how much we can actually rely on that as a source for the global health security agenda?
Yes. This is a pretty interesting question in the context of some of what we've been discussing over the last couple of days. So is pandemic preparedness a public good, or is it a global public good? Because we've sort of said both, I think, over the last couple of days, and it gets to this question about whether it's a public good that a country would want to support for its own pandemic preparedness, or whether it's something that's larger, where both individual countries and then countries in other places that are part of the international community but that could be affected by a pandemic, whether it's a global public good. So I think that's an interesting question, and one that we've touched on in a couple of the sessions that we've had, is as to how we actually conceptualize that. Maybe it's both. So if it's a public good, then public goods are those where the donor community can incent and advocate and support more domestic public spending that goes to finance those public goods. If it's a global public good, it shifts responsibility a little bit. And I think we saw that pandemic preparedness definitely crossed country boundaries. So clearly there is some sense of shared responsibility between the global players and the countries that are affected. So of course, by their nature, public goods are best financed using public financing, and one element of that public financing are taxes. So it's clear then that general taxation would be appropriate for supplying a part of that financing. And I think there's been a huge commitment, most recently articulated in the ADIS tax initiative, which I imagine that most people here are familiar with this. It was signed in July at the Financing for Development conference in ADIS, and 30 countries and international organizations launched this and signed a commitment. And the commitment is to catalyze a significant increase in domestic resource mobilization, and to address what are billions of dollars that are lost every year due to issues like a narrow tax base, weak administrative capacity, and poor tax compliance. So this is an effort to improve the fairness, transparency, and efficiency of country tax systems. The explicit commitment of those that signed up is to double the technical cooperation in domestic resource mobilization by 2020, to adhere to a core set of principles that will enable effective revenue collection and to ensure policy coherence. So a number of the countries that are present at this meeting were among the original signatories at the Addis event. That includes Norway, it includes the UK, it includes Liberia, it includes Ghana, it includes the World Bank, and it includes the United States. Now, at USAID, we are working and have been working for some time on this in a couple of different ways. One way is quite broadly on projects that we have that deal quite explicitly with tax administration and tax compliance. We have over $100 million across different countries and different activities where we're working specifically on that. And then in global health, we're also working specifically on a domestic resource mobilization initiative in a small number of countries where we're really working with the ministries of finance and the ministries of health to explicitly increase domestic resources for the health sector. And this can sometimes be a contentious area where certain economists feel like the real issue is expanding the pie, and that the point of domestic resource mobilization isn't to necessarily attract resources for any particular sector, but to increase the whole. And then there are others that are working on this with an eye towards explicitly getting some of the increased pie directed towards priority programs, and in our case, specifically in the health sector and health programs. So we're working in a number of countries, among them Tanzania, Kenya, and Vietnam. I think those are where we've gone the furthest, and those are all countries that have experienced quite considerable and sustained economic growth over the last few years, where the opportunity to have a secure domestic financing system and a well-administered one, it can definitely pay benefits now, but it's also laying the groundwork for paying a lot of benefits over time in the future.